Unfortunately, just in time for the holidays, we're seeing COVID-19 numbers start to trend upward once again. The Omicron variant is spreading, but what does that really mean for another potential wave of COVID-19? Well, joining us here on KVUE to talk about this is the Associated Director of UT's COVID-19 Modeling Consortium, Dr. Spencer Fox. And Dr. Fox, thank you so much for joining us.
Yes, thank you so much for having me.
All right, first off, let's start talking about the consortium's new projections. You say Omicron could lead to, quote, the largest healthcare surge to date. And that actually sounds pretty alarming. So what should people take away from that?
Sure. We just put together projections across 16 plausible scenarios of what might happen to Omicron. Its current transmissibility is extremely uncertain, and the severity is also uncertain. And so we looked across those ranges. What we found was that it's likely that we'll see similar reported case counts to what we've seen at previous peaks, like January of 2021. But things could look a lot worse depending on Omicron's inherent characteristics.
Well, doctor, if there's any good news about Omicron, it's that most cases haven't been as severe. What are the symptoms people should really look out for?
I think what people should look out for is the standard coronavirus symptoms that we've known about for the past 2 years. I think it's still extremely uncertain whether Omicron will be less severe compared to previous variants. And the reason is that most people who've been infected with Omicron so far have already had prior experience, their immune systems, that is, with coronavirus. And so either they've been previously infected or they've been vaccinated. And so we don't yet know the severity of Omicron compared to other variants.
So how does this affect projections for hospitalizations?
Sure. You know, what we see is a wide range of possibilities for what we'll experience in the healthcare world. If Omicron is less severe than previous variants, and if it's not quite as transmissible as some expectations suggest, we may actually see a healthcare surge that isn't much larger than what we saw in the summer of this year. If Omicron is more severe or just as severe as previous variants and is more transmissible as we're seeing around the world, we could see healthcare capacity reached very quickly, and these surges could be much larger than previous surges.
So how important are boosters in keeping us from seeing another surge? And are some boosters actually better than others to get?
I think booster vaccinations are one of the most important things that people can do right now to protect themselves and to protect their community. Looking at our projections, we see that booster vaccinations, increasing the rate of boosters in our communities can reduce the overall hospitalization and mortality rates by anywhere from 10 to 20%.
So what does this mean for Delta variant cases? We've been hearing so much about Omicron lately. It seems that Delta has almost been forgotten.
Yeah, I think we're in a very precarious place right now in our community and as a country as a whole, because we're already in the midst of a potential Delta surge that looks very similar to what we saw last winter. What our concern is right now is that transmission levels are already very high and that Omicron exacerbates those trends.
So, doctor, what advice do you have for people who are going into the holidays?
I think the best advice I could provide right now going into the holidays is to try and take as many precautions as possible and to be flexible with your plans. I think if you can, going and getting vaccinated, getting a booster vaccine, I think it's very useful and underutilized to use rapid tests to prevent transmission at holiday gatherings. And I think it's important to continue wearing masks indoors and increase ventilation while gathering as much as possible.
Lots of good advice. And Dr. Spencer Fox with UT's COVID-19 Modeling Consortium, thank you so much for joining us here on KVUE. We appreciate it.
Thank you for having me.